All right, so it's just 7:30. It's November 13th, and the meeting is called to order for the Board of Health. We have a quorum. Thank you. In terms of the minutes from last meeting, any additions, corrections that anybody has? So, I have a motion to approve the minutes. All in favor? Any opposed?
Yeah.
No? So minutes are passed, so we can move on ahead to
the reports. Okay, so this past month, we had a couple meetings with the Health Improvement Alliance, which is, I think I've said before, it's both hospitals, all the healthcare facilities in the area, all the local health departments, and we come together to do various health improvement initiatives. But one of the things we do collectively is the Community Health Needs Assessment and the Community Health Improvement Plan, the CHNA and the CHIP. And so we just finished the 22, and now we're planning now for the 25 version, and so we've started the process. And we'll be looking at a couple, trying to improve sort of data collection. You know, a lot of us feel like from a statewide perspective, the data is very good. You know, one of the companies that we use to do the quantitative part of it, Data Haven, does this large statewide survey, but when it comes down to Fairfield, there's only, 250 participants in the survey. It's a random digit dial telephone survey, so it's a statistically valid method, but it's a very small number. And so it's hard when you get down to, when you stratify the sample to say, okay, so women feel this way, well, you only got 120 women. And then if it's women who are this age, well, then the number gets pretty small. And then women who are this age that express an opinion about this issue, the numbers get so small, it's hard to generalize. So we're looking at ways to try and improve both the quantitative data that's collected in terms of the numbers at each local municipality. For example, like Easton had like 5 surveys, while it's great on a regional level, but for local planning, you really can't say, based upon the data from our survey, we're gonna spend money on X, and it just doesn't work as well. So we're looking at ways to improve that, and that's sort of we've started that process. So we're still, a little over a year out before we start the collection methods. But so we're looking at that quantitative data as well as some of the qualitative data. And then every year, so that we collect the data, and then we have a prioritization session. So, and I don't know if you've been a part of that in the past, where we met for a number of years up at the Discovery School, and had everybody come in, and we put the different issues that kind of rose to the top, and everybody gets dots. And they go around the room and they sort of vote on the different issues that they feel are the ones that should be prioritized. And we've done a couple different methodologies like that. And last time we used a company called Community Voices, which did it a slightly different way. But so we're looking to improve that. Some people didn't feel like included in that because it was, again, just a limited number of surveys that kind of went into that. They went to each town and had, MPH students with tablets, asking people at libraries and senior centers and things. And it just really wasn't a lot of the participants didn't feel like their voice was heard. And so we're going to work on that. So that's kind of the focus of that. I did have the opportunity to participate in a Fairfield County Region 1 disaster behavioral health workshop, which was a really impressive workshop. And we heard about, some overview of the Region 1, which is the DEMIS region, the Department of Emergency Management and Homeland Security is DEMIS. And the Region 1 is from Greenwich to Stratford and about as high as Easton and Monroe. We have a plan, a public health emergency response plan, and there's a behavioral health annex, and so there's sort of an annual chance to review that and the details of that. We had representatives from the DBERN team, the Disaster Behavioral Health Response Network, which is a state entity that the state coordinates it, but it's comprised of local behavioral health providers, and so those are people that respond to behavioral health needs. So, for example, when Sandy's Hook school issue happened there. The DBURN team was on site for months, rotating through different counselors and therapists. And I think DBURN members were assigned to each family. And then we also heard a review of the Fairfield County trauma response team, which I hadn't heard of before, but these are therapists that specialize in trauma and work predominantly with police and fire, and give a very sort of stirring presentation about the impact of that line of work on individuals, and that the fears associated with that profession of like not wanting to admit to anything for fear of having, being suspended, having their gun taken away, having their, livelihood taken away. They feel like they always have to be strong, and the impact that has on it. And but it talked about the need to expand that their scope to include folks like healthcare professionals that were responding during COVID and public health professionals as well. And so that's one of the reasons they were presenting to us. It was a room full of public health and behavioral health professionals, and they use they specialize in in EMDR technique, which has now become apparently the gold standard for resolving trauma. So it's a new thing, and so they're kind of sharing it and sharing some of the results of the studies they've done to show how it really helps those who've experienced trauma in their workplace or in their lives in general. But so we're looking to bring that a similar presentation to a large. This is a group of public health preparedness people, but we're looking to bring that to the region. It's really about bringing awareness of. One of the benefits of the presentation, I thought, was walking through, if you've got these issues going on, it's not a guarantee, but there's a chance this could be the result of some trauma in your life, either professionally or personally. And, and there's steps you can take to resolve that. And then they provide resources of, okay, you've heard this presentation, what can you do next? And so I thought it was a very valuable presentation, and we're going to bring it to a larger group coming in the near future. In terms of our grants, we have met with the state, so that we did get, we have mentioned many times we got turned down for that one grant, but we're still, and we got the per capita grant, and that's all funded, but we have two other grants that we're still waiting to hear upon. We met with the state to talk about some of the nuances, so they keep wanting to, we use this contracting portal called Core CT that is very complicated, but they keep calling us and say, well, we need you to move $78 from this line to that line. And then we go in and we do move the $78. Then they send us an email the following week saying, we saw that and we need to move it back to this other line. And, and it's this back and forth. And we had hoped to have all these contracts. We were told we'd have them in September. But now that we are here in early November, and now that there's been an election and potentially a change in leadership, in the very near future, that the signatory on the contracts is the first select person, and so now all the contracts are out of date, are not accurate, so they have to go back to the state to be changed. So we're, and it creates, there's a multi-step process even internally when the town to authorize someone to sign contracts. So now we have to kind of go through that process and change that. And, the state really hasn't given us even language of what's in the contract. So, we're a little bit frustrated by it, just the delays at the state level. They have valid reasons at the state in terms of the Attorney General and all the approvals they have. But what it comes down to is that, these grants one grant goes till early 25, and it's supposed to start in September. So now we're 3 months into it. We don't even, and we're not even looking at probably having a signature until January at this point now. Anyway, just a little frustrating that some of the delays of the grants. It won't have a significant impact on us, I don't believe, but it's just a little frustrating and nice to have that wrapped up and done. We did have a meeting, so the State Department of Public Health has started meetings with local health departments, the state, and the infectious disease staff at local hospitals and nursing homes and other places where they'll review different issues. This month they talked about, the immunization coordinator for the state talked about the current RSV recommendations, some of the limitations on delivering that, and some of the supply shortages that they're already experiencing for some of the treatments for younger individuals, some prevention steps that they can take. So, and then Dr. Bieluk from Yale did a presentation on the new vaccine, the XBB vaccine, and its effectiveness for treating the current variants. And the long and short of it was, it seems to provide as good a protection as the other previous vaccines did, even though the variants have changed from when that second XBB variant was the predominant circulating variant. It's still providing the same level of protection against severe disease. And the good thing is the COVID is still very low nationally and in the state. It actually seems to be continuing to decline since mid-September. But DPH did announce that there was the first 2 flu and RSV deaths in the state in individuals that were in the 80 to 89-year-old region, one from New Haven County and one from Middlesex County. So we're starting to see the start of the flu season in that regard. In terms of town budget, we are starting that process. So we'll submit the town budget this week with no significant changes. We did get approval today for the 2 new part-time positions to cover the new school that came up, so we'll be moving forward with that. And then we did meet with the emergency management team in town, the school, the police department, to talk about the initial planning for a full-scale exercise related to school reunification. So essentially, if there was an event at a school and the school had to be evacuated off campus, how do we reunite those students with the parents? And so there's some state funding that's available to hire a consultant that's going around the state right now to sort of offer these presentations on this is the type of plan you should have. We have a plan in place, but it's basically getting the schools to move forward and exercise that plan. So to have that included in the, so every school does a fire drill or some type of drill every month. They do a lockdown drill 3 times a year. That's one of the monthly drills that they do, and they're trying to include some of the principles. They're trying to work into those monthly drills that a few of those should be reunification type drills where you're not necessarily moving students, but you're doing the initial part of that it's eventually a form of an evacuation drill, and they would do everything but relocate the students to another site. But this planning is related to a training that will happen in March where they'll meet with the school leadership team throughout the entire district, and then they will plan a full-scale exercise sometime over the summer where they'll actually have mock students and buses and relocate people and reunify them and go through that process. And it's really an accountability issue, just ensuring that you've accounted for everybody and that they made it to where they were supposed to be and that the person picking them up is somebody on their list that's legally able to pick them up. Lastly, with the help of the first selectwoman and her staff, the health department is now driving entirely electric vehicles. And you see it out in the back parking lot now. We've got some 24 new electric vehicles, and so the health department turned in all their old Ford Crown Vic police cruisers, and now we're all driving new Chevy Bolts or Nissan Leafs. We have two types, and so it's a little bit of a change, and they've instituted so we don't have as many cars assigned to our department as we had before, but there's pool cars. And so there's a fancy sort of code box down at the end of the hallway. You enter the code and take a key and,
there's a charger here.
and they put in some, I think there's 20 different chargers there that are just for those cars. Like you have a key fob that activates it, and so it's not for like the general public can't, because if it was, you'd see 20 Teslas out there, people reading papers, waiting their cars to charge, like at the Milford Post Mall, But that's a good sign. We're moving forward with that, and so that's all I have for now.
Okay, great. Thank
you. Any questions?
Yeah, just why on the contract piece does, I guess, the current leadership signature why is it not valid on the contract? Right, there's a current, why that delay there? From that standpoint, that doesn't make sense to me. There's not a new leader in place yet.
Yeah,
why?
And so it's a matter of who's been given permission to sign the contract, and will that happen by the time the contract arrives? So I don't even have the contract yet.
Oh, so it could be an arrival issue.
Yes, so it could be an arrival issue, and to authorize somebody to sign the contract. So I don't have the contract, so I can't say to somebody, sign this, can you sign this contract? Because I don't even have the contract, and so I can't even get approval for the CEO to sign the contract because I don't have the contract. So once I get the contract, then we can start the process to approve it. I think by that time, the transition would have happened. If the transition does go into a place, if we do have a new leader, if not, then it would go a little smoother. But it's just a timing thing. Every contract for the state, when it's the first time, it always seems like it's this way.
I was just going to, I guess, state and also ask the question then, would you say that the current Board of Selectmen, Selectwomen and Selectmen have been supportive of all your initiatives?
Oh,
absolutely. For the most part, and on the board, that's the health department. It sounds like with the electric vehicles, it sounds like with all of these grant initiatives, that everything has been
we've always had, in my opinion, good support from the first select person's office, who's ever there.
Right.
It's always been supportive. One of the things, in terms of our budget and initiatives, is we don't ask for a lot. We don't ever I've never asked for any kind of significant budget increase other than, hey, we need the nursing discussions that we've had here, where we have a new school or we have a new high demand in these two schools, so we ask for additional positions in that regard. So we ask for stuff, but we're not a capital project heavy intensive thing, and so we always seem to get good support. And I think the boards, both the first select person's office and the various boards and commissions that approve our budgets and our projects, always seem to be in favor. And I think we are always managing 4 to 5 different grants, and they like that when we bring in outside funds into the town to support projects and initiatives. So
well, that's frustrating that the continuity piece can potentially be a spanner in the works of the grant.
Well, the good thing about one of the grants is the immunization grant. Is we're already predominantly through the immunization season for us, and so it really doesn't have any impact on it. And it was likely not going to, by the time we get the funds and then hire people, we were always going to be beyond this flu season. So it's not going to have a big impact in that regard. And the workforce development grant, which is the second grant that we're still waiting on, that individual that's going to transition to the workforce development. So the workforce development is you can hire new people, you can train your existing people, or you can extend somebody that's on another grant-funded position. We've just decided to extend an individual, one of the folks that's working with Santina, our current COVID coordinator. But that grant goes until, I want to say May. So
which
she's
grant?
The
COVID coordinator?
The COVID coordinator grant, the ELC2 grant, goes until May, and so she wouldn't even be transitioning to that grant until May, because we want to expend all those funds first, and then switch.
Given the significant decrease in COVID cases, what is her current role?
So what the state has allowed is basically that person to be essentially like an epidemiologist. So anytime we have any kind of cases of anything, any infectious disease cases, that team sort of takes the lead on that and assists with that. So with the Legionnaire's disease issue that we had and with other issues, they take the lead. They're still available to talk to people about COVID. They still call people with COVID, say, hey, have any questions? And so, but they, she's basically taken on a role of providing immunization education, immunization support, infectious disease support. And so really that's, the appropriate term would be like the emerging infections coordinator, and so the state has allowed a transition. So she's, really doesn't do too much related to COVID anymore.
Right.
But and again, because that grant goes till then, it really, the delay doesn't impact us. It's just a frustrating thing that, we'd hoped to have this done in September, but it's not. But again, the state is always that way. Okay.
So, I guess we don't have...
Rob's on the phone.
Oh, great. I didn't know.
Rob had
Hey, Rob.
had an issue where he was home for one of his children's soccer games, and then,
Awesome.
He lives in Watertown, so
Oh, my God.
I told him, you don't have to drive back.
Definitely not. Hey, Rob. So you can...
Hi, how are you?
For sure. Thank you.
Go ahead, Rob.
Thanks. So just a couple of things that we've been working on. We normally, during this time of the year, deal with overcrowding complaints down at the beach, with student rentals and so forth. This year has been really quiet. We've only had one that I worked on myself, did surveillance like we normally do. Haven't noticed anything out of the norm. So that's been good. Hoarding complaints, I had one that I actually didn't even really have to go out to, was at Parish Court. So it was through the police department. They actually called me in, asked me if I can work with them. I was able to go back and forth just with emails because the resident that was there was actually in the hospital, and Parish Court worked along with their team to go in there and really clean the place up. So that worked out really well, so that resident can go back there in a timely fashion. One of the things that we also touched on in the past was the adoption of the new FDA code and working in with restaurants, the transition, which is actually over the last 10 months since it's been adopted, 10, 11 months, it's been a pretty smooth transition. And one of the things that we did as we talked to the staff is that they can send pictures and reports on corrections that they had. So we developed our own, we came up with an own email that they send it's at corrections.fairfieldct.org. So it makes it easier for restaurant owners just to we have stickers that we put on our inspection reports. They take their pictures, they send in documentation straight to that email. And currently we have Kim monitoring that email, and she'll come back and show us what's been corrected. So that's actually helped us because of the new FDA code. Inspections are supposed to happen more frequently, but they're able to send in the documentation, and Kim's monitoring that email, which has made it a lot easier for them to get things done quicker and without us having to go out 48 hours to something that can easily be sent in by a picture. So that's been, I believe, very helpful for the restaurant owners and also ourselves. As far as the food program, today actually we put up food safety for holidays. So you can go on our social media site, you can go on the webpage. There's a link to the CDC. Proper cooking temperatures, proper food handling. It's something that we always do during the holidays. So that's up on, again, social media and our webpage. The two food inspectors that were in training, Santina finished her Kim and Santina finished her 25 shadow inspections. Santina just finished her 10 candidate-led inspections with our in-house food inspection training officer, which is Melissa Sorcelli. We're fortunate enough to have one right in our office. Kim should be starting her 10 candidate-led inspections hopefully next week. Sands and I haven't talked to Sands about this yet, but we're going to sending all the paperwork through Melissa to the state and hopefully get them both on track to be
So, Rob, I just have one quick question. So I think it's good. So the restaurants, if there's something that they need to change, and they could send an email, and so I assume they're sending a picture of what they've done, so that things can move along. Does that have to be corroborated? And I understand it could take much less time to do that. But are we going out at some point and checking that, or we're just using that as the information is that all that's needed?
It depends really what it is. So say, for instance, if a cooler is down and underneath the FDA code, they can't send supporting documentation, and we'll accept that based on the FDA code. But if it's something such as a rodent problem or anything along them lines, if they do send us reports, we will still go out and do a spot check. But if it's something such as a cooler that's down and they take a temperature of a thermometer that shows inside that cooler that it's properly working, the FDA code does allow them to do that, and we will accept that.
Yeah, that's good. That seems fine. Great.
Yeah, it just depends on what the violation is and the relationship with the operator. So there's operators that we would say, yep, that we've had a long relationship with, and we understand and have a mutual respect for them and how they operate their establishment. And then there's always people that are that we have more challenges with, and so we'll often go out and monitor them a little bit more closely.
I didn't hear what he said about Parish Court.
So there was a hoarding case at Parish Court.
A what?
Hoarding.
Oh,
So often what happens is we get a call from police and fire of an individual that's gone to the hospital.
Yeah.
When they go in to get them, they find that the dwelling itself is not habitable from a sanitary perspective. And so we get called to make a determination, and we have the authority to post a house as unfit for human habitation.
Right.
Once that goes on, that person can't come back, and so the discharge, usually a social worker at the hospital who does discharge planning, if the house has been declared unfit, then they can't come back to the house. They have to make other arrangements. But we'll often work with friends or family members, or in this case, the Parish Court Association, to go in there and help clean up the home so the individual can come back safely. So.
No, the reason I ask is because I'm involved with Sobel McKinney as their president, and Millennium, and the company, we're involved with both companies. Like Millennium runs Parish Court, and they're elderly housing management, and they're the ones that supervise us. And I was just kind of curious as to what happened, because that sounds terribly unusual to me.
Yeah.
Something like that would go on.
Yeah, I mean, it just depends on the different conditions. So a house can be declared unsanitary for a couple of different reasons, and some of which can happen very quickly. And so, but in the case of hoarding, sometimes, usually, typically, it's often the case that when we come across a hoarding complaint and we talk to the family, they are all surprised, and none of them had been in the apartment or had an inspection of any type in, decades. And so
it's usually a neglect type of thing that's going on.
Just so I can.
A lot of
parents.
Go ahead, Rob.
This is more of a from what the police officer and I, when we talked about it, when I said hoarding, it was more of a cleanliness issue, some hoarding. There was a family member that was involved. I guess it was on their radar, just so you know. So once we called them, they were very receptive and said, we're just going to get permission to go in there and clean it up, and that's exactly what they did. So They were working with this individual, but I just think when they got the call from us and police was out there and they were in the hospital, the residents, that they said, okay, let's use these days while the resident's not there to really just get everything completely cleaned up, and that's exactly what they did.
Yep.
I'm just surprised management allowed that to happen.
Yeah, I don't know if they, again, a lot of times in these situations, the management doesn't necessarily have the right to come in and conduct inspections sometimes. Sometimes, depending on the lease and the arrangement, sometimes they do, but it just depends. And again,
That's one thing we haven't had at Sullivan McKinney, thank the Lord.
Yeah.
We've been very fortunate that way.
Yeah.
Great. All right.
Okay.
Rob, thank you very much.
Actually, I just had a question. Just given the time of year, are there any provisions in place to kind of avoid another SantaCon incident like last year with the overcrowding on the beach and?
Yeah, Rob, do you recall what they said about SantaCon? We did meet with them with the Fairfield Beach Homeowners Association and the university, and I know they had talked about SantaCon. Do you remember what they said they were going to do with that, Rob?
So, with SantaCon, like any party or whatever you want to call it, happens down at Fairfield U. Fairfield U I believe, was going to take it over. They were going to take it over and make it, not a student-run function, I guess you can say. We don't get involved with SantaCon when the students do it, but for instance, Clam Jam, if you remember years and years ago, it was vastly different than now. They'll have their Aramark, who I forgot exactly who's running the food up there at this moment. They'll come to us if they're going to serve food or anything to make sure they have everything in place. I haven't heard anything as of yet, but when they were talking about it, they were going to probably run it through the university, or attempt to if the students still wanted it.
Yeah. So what happens is the university takes it over, and then another event will pop up. That's not university related, but again, but I think the meetings that we had that we talked about last month with the Fairfield Beach Area Association and everybody involved, the business owners down there, both associations, housing groups, that they are really working hard to sort of identify all these different events, the planned ones. There's always going to be the spontaneous events, and sort of work with, like there's one of them now that's like at the Sea Grape. It's a ticketed event. There's only so many tickets. They, have extra security there, and so they're working to control those things. But, there'll always be that tension between,
Natural.
kids, again, it's not even necessarily the organizers themselves, but a lot of it can be attributed to social media, where you plan a party for 50 of your friends, and then all of a sudden becomes 500, and it's gone out, in a matter of an hour through social media and Uber and all that, and so things grow very quickly there, and that's been the experience the last couple sort of unplanned large events with that, where just the word spread. And then, the students are actually calling the police themselves to say, can you come and break up this party, so.
Great. All right. So, were there any communications from anybody? I didn't get any. Is there any old business anybody wanted to discuss, unfinished business? Is there any new business?
Well, under old business, under A there, we have last month Jill presented a policy to the board, and there was sort of a lack of clarity on my part. So this particular policy, so this is the administration of medication policy for the schools. This one policy has a provision in it where it says, the Board of Ed specifically requests the Board of Health to approve the policy. So I know last month you were going to move forward and approve it, so I would just say, if you're willing to approve that, to make a motion to approve the changes to the naloxone administration policy as presented last month.
Right. So, is there a motion to approve the new naloxone policy?
To approve it.
Second. Okay. All in favor? Any opposed?
All right, thank you. Yep, it was just, I had to go back and actually read through the policy, and there's one line in there that says, all right, they want Board of Health on this one.
Yeah, no, I think it does make sense.
Yeah.
I think that was the right thing, for
Yep.
sure. All right, so was there any new business that anybody wanted to discuss? Any other comments? No? All right, so can I have a motion to adjourn the meeting?
So moved.
Second.
You're adjourned.
All right.
Thank you very much.
Thank you, everybody.